It's no secret that exercise is well known for improving the health and well-being of our bodies. This list of bodily benefits from consistent physical activity is lengthy. For example, a few of these benefits include a lower risk of heart disease and type 2 diabetes, an improved body composition, more restful sleep, enhanced resistance to colds and other infections, a lower incidence and severity of anxiety and depression, as well as a longer and higher quality of life. But, one more important benefit from exercise specific to men is a healthy prostate. That's because exercise is a turbo boost for improving prostate health. Numerous scientific evidence has shown that regular physical activity helps prevent prostate issues such as benign prostatic hyperplasia, BPH, erectile dysfunction, ED, prostatitis, and prostate cancer. Here is a look at several studies in recent years encouraging men to become more physically active for the sake of their prostate. Men with belly fat have an increased risk for prostate cancer. However, men who follow a healthy dietary plan along with regular exercise, this cuts the risk in half. Physical activity is considered a natural antioxidant for the body, helping reduce free radical formation. Free radicals are associated with the formation of cancer cells, including prostate cancer. A study from the Journal of Sexual Medicine found that men under age 40 who exercised regularly were less likely to experience sexual dysfunction than men under 40 who did not exercise. Vigorous exercise has been found critical for men with early-stage prostate cancer. Men who exercised vigorously for at least 3 hours a week activated more tumor-suppressing genes and more genes involved in repairing DNA than men who exercised less. The trick to making exercise work for enhancing prostate health is knowing how much and what kind of physical activities are best. Aerobic exercise. Any aerobic exercise that gets a resting heart rate above normal for a sustained length of time, brisk walking, jogging, biking, and swimming, is good for both prostate and sexual health. The American Heart Association recommends ideally 30 minutes or more of aerobic exercise most days of the week. Interval training. Belly fat is one of the most stubborn forms of fat for men to reduce. Nestled deep within the abdominal area, belly fat is associated with increasing the risk of BPH and prostate cancer. Unlike walking or running for long lengths of time, interval training is different. Walking or running usually involves the same movement repeated over and over with little to no variation. But, interval training helps break up the monotony. Interval training is doing short bursts of different exercises, preventing the body from getting used to one type of motion. For example, a person could walk briskly for 2 minutes, sprint for about a minute, and keep switching back and forth. This type of exercise even increases a person's resting metabolic rate for up to 24 hours after exercising. Kegel exercises. A specific type of exercise for men and prostate health is called a Kegel exercise. Especially helpful for BPH symptoms and possibly even for men with ED, performing a Kegel can be done anywhere, any time of day, and no one will know you are doing them. To perform a Kegel, squeeze the muscles you would use to hold your urine. Hold the squeeze for a few seconds and then release. Try doing 3 sets of 10 Kegel exercises every day for better bladder control. Key takeaway. The most important thing for men to remember regarding exercise is to choose an exercise they enjoy and will stick with long term. It's also advisable, especially for men who have been inactive for a while or have physical limitations, to check with their doctor to ensure the exercise level is safe.